Intermittent fasting is a popular eating pattern that has gained significant attention in recent years. It cycles between periods of eating and voluntary fasting, creating a structured approach to meal timing. The focus is on when you eat, not necessarily on what you eat. This can make it easier for some people to follow compared to traditional diets. Many people try intermittent fasting to lose weight and improve their overall health, including better metabolic function and increased energy levels. There are many ways to do intermittent fasting, each with its own set of rules and benefits. One popular method is the 16-8 method, where you fast for 16 hours and eat within an 8-hour window. This method is often preferred because it fits easily into most people's daily routines. Another method is the 5-2 diet, where you eat normally for 5 days and restrict calories for 2 days. This can be more flexible for those with varying schedules. Intermittent fasting is not a diet in the traditional sense. It's more of an eating schedule that can be adapted to fit different lifestyles. It's about changing the timing of you eat, rather than focusing solely on what you eat. This can help reduce the stress and complexity often associated with dieting. It's important to note that intermittent fasting might not be suitable for everyone, especially those with certain medical conditions. Always consult with a healthcare provider before starting any new eating pattern. Intermittent fasting has gained popularity due to its potential health benefits. Many people experience weight loss due to the calorie restriction that often happens naturally, but the benefits go beyond shedding pounds. Studies suggest that intermittent fasting can improve insulin sensitivity, helping your body regulate blood sugar levels better. It may also lower bad cholesterol and improve blood pressure. Some people report increased energy levels and mental clarity during fasting periods. While intermittent fasting offers potential benefits, it's not a magic bullet and comes with risks. Some people experience side effects, particularly during the initial fasting phase. Common side effects include headaches, fatigue, and difficulty concentrating. Fasting can also lead to dehydration if you don't drink enough fluids. It's important to listen to your body and stop if you experience severe discomfort or adverse reactions. Pregnant or breastfeeding women, individuals with diabetes, and those with a history of eating disorders should consult a doctor before trying intermittent fasting. Section 4. The science behind intermittent fasting. Research on intermittent fasting is ongoing, with promising findings and some limitations. Scientists are delving deep into understanding how fasting impacts our bodies at a cellular level. Studies in animals have shown positive effects on weight and metabolic health. These studies indicate that intermittent fasting can improve insulin sensitivity and reduce inflammation. Human studies have shown that intermittent fasting can be as effective for weight loss as traditional calorie restriction. Participants often report feeling more energetic and less hungry. However, more research is needed to understand long-term effects. The current data is promising but not yet conclusive. It's important to note that most studies have been conducted on small groups or for short periods. This makes it difficult to generalize the findings to the broader population. More extensive long-term research is needed to confirm the observed benefits and understand any potential long-term risks. Only through comprehensive studies can we fully grasp the impact of intermittent fasting on human health. Section 5. Making informed decisions about your health. In this section, we will explore the importance of making well-informed choices when it comes to your health and wellness. Intermittent fasting is a personal choice that requires careful consideration. It's essential to understand the potential benefits and risks associated with this dietary approach. Before making any significant changes to your diet or lifestyle, talk to your doctor. A healthcare professional can provide personalized advice based on your unique health profile. This is especially important if you have underlying health conditions or take medication. Your doctor can help you understand how intermittent fasting might interact with your current health status and medications. Consider your individual needs and health goals. Tailoring your approach to fit your specific circumstances can lead to more sustainable and effective results. Intermittent fasting isn't a one-size-fits-all solution. What works for one person may not be suitable for another, so it's crucial to find a method that aligns with your lifestyle and preferences. If you decide to try it, start slowly and gradually increase your fasting window to allow your body to adjust. This gradual approach can help minimize potential side effects and make the transition smoother. Listen to your body and don't hesitate to adjust your approach as needed. Your health journey is unique, and it's important to remain flexible and responsive to your body's signals. Section 6. Your journey to natural weight loss. Navigating the world of weight loss can be overwhelming. Intermittent fasting is one approach, but it's essential to make informed choices for your health. For more tips on losing weight naturally and exploring different approaches, check out our free report. It's packed with evidence-based advice to help you achieve your health goals safely and sustainably. Remember, knowledge is power when it comes to your well-being.